Hey everybody, I'm Tanner LaPointe from the Schizophrenia Society of New Brunswick. Today we're going to be talking about schizophrenia. So let's jump right into it. So what exactly is schizophrenia? Schizophrenia is a psychotic disorder that results in the individual experiencing something called psychosis, which can be defined as a break or separation from reality. Somebody with schizophrenia experiencing active psychosis may not be able to differentiate between what is real and what is not real. Schizophrenia can be very distressing. If you think about it, not being able to tell what is real from what is just in your mind would be very distressing. Most individuals with schizophrenia live in recovery. Recovery is expected. Schizophrenia is by no means a life sentence. Most individuals with schizophrenia recover from their symptoms and live happy, fulfilling, meaningful lives. Schizophrenia is not a life sentence. So what does schizophrenia look like? What are some of the symptoms? We can break down the symptoms of schizophrenia into two major categories. We have positive symptoms and we have negative symptoms. Contrary to what the names may sound like, positive symptoms are not things that are good, and negative symptoms are not things that are bad. Positive symptoms refer to symptoms that are added to the individual as a result of their illness. Negative symptoms are things that are removed from the individual as a result of their illness. So think of the little plus and minus sign. So let's get into some of the symptoms. So some of the positive symptoms of schizophrenia. So we have hallucinations. A hallucination is a false sensory experience. When most people think of hallucinations, we think of visual hallucinations, seeing something that's not really there, or auditory hallucinations, hearing something that's not really there. But we can actually experience hallucinations in any of the five senses. We can have them in one, or we can have them in all, or anywhere in between. The most common form of hallucinations in schizophrenia are audible hallucinations. Audible or auditory hallucinations refers to hearing something that's not really there, often in the form of voices. Now, these voices are generally not very nice. They're usually very nasty and can be very distressing to the individual. Another positive symptom are delusions. A delusion is a false belief. So the individual strongly believes something that is not true. When a person is experiencing a delusion, they will often not separate from their beliefs, even when presented with contradictory evidence. Paranoia. So the individual might think that people are out to get them or conspiring against them. Disorganized thinking and speech. So the individual might jump from one topic to another topic without any logical connection. Somatic concerns. The individual may have irrational fears about their body. For example, the individual might feel that they're rotting from the inside out. But let's get into some of the negative symptoms. So some of the negative symptoms include social isolation and withdrawal. Anhedonia, which is lack of inability or the lack or inability to experience pleasure. And flat or inappropriate affect. Affect refers to our emotions. Flat affect would be experiencing no emotion at all. Inappropriate affect, on the other hand, would be experiencing emotions that are not typical of the situation. For example, the person might cry while watching a funny movie, or they might laugh when hearing about somebody's death. Other symptoms include anxiety and depression. So what exactly causes schizophrenia? So like most disorders, there's not one specific cause we can point to, but there are some contributing factors. These factors can be broken down into two categories: biological factors and environmental factors. So some biological risk factors of developing schizophrenia. So genetic predisposition, which is a family history. So if somebody in your family has schizophrenia, you are more likely to develop the disorder. Abnormalities in brain structure. Studies have shown that people with schizophrenia have very distinct differences in brain structures from a quote-unquote normal brain. Prenatal complications and having a father of older age is another biological risk factor. Environmental factors, brain injuries, using psychoactive substances, especially in adolescence and early adulthood. Our brain is still evolving and developing until we were about 25 years old. So using psychoactive substances before then can be a potential risk factor for developing schizophrenia and other psychotic disorders. Most people don't realize that cannabis is actually one of the most common triggers for psychosis. So legal does not mean safe. Extreme stress and lack of positive coping skills. We all experience stress. Stress is a normal part of life. Stress doesn't necessarily have to be a bad thing. Stress helps us be productive and helps us react to real fears. But when we have too much stress or we don't know how to cope with stress appropriately, it can become a problem. And being exposed to viral infections, especially in early years of development, can be another environmental risk factor. So the treatment for schizophrenia. So we have treatment with medications and we have psychosocial interventions. These two are often used in conjunction. So treatment with medication. So schizophrenia is usually treated with antipsychotic medication. Antipsychotic medication works by restoring the balance of certain neurotransmitters in the brain. Most antipsychotic medications have a great deal of effect on dopamine. Studies have shown that people with schizophrenia may have an excess of dopamine. So some antipsychotic medications include olanzapine, risperidone, and quetiapine. Sometimes, especially in a hospital setting, an emergency injection may be used if somebody with schizophrenia is in crisis. Some emergency injections include Clopixol or Halidol. Psychosocial interventions. So psychosocial interventions are often used in conjunction with medication. Some psychosocial interventions include cognitive behavioral therapy, and cognitive behavioral therapy works by changing the way we think and feel. And family support and education. So I'd like to thank you all for taking the time to watch this video today. I hope you found it helpful and informative. For your benefit, in the description of this video, we're going to include some resources for the Miramichi area if you were looking for help to deal with mental illness and mental wellness. Of course, if you were in crisis, please call 911 or proceed to your nearest emergency department. Thank you. Have a good day.